Good morning and welcome to everyone to today's webinar entitled COVID-19 and the Cerner Billing Process. My name is Mark Haglund and I'm the Editor-in-Chief of Healthcare Innovation. Today's program is sponsored by SoftTech. Thank you to our sponsor and to our audience for giving us your time and attention today. Before we get started, I have a few housekeeping details to share with you. To submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, join our webinar conversation on Twitter. You can tweet using the hashtag #HILiveWebinar. At this time, it's my pleasure to introduce our speaker for today's program. Chris Lanneman is Executive Director of Professional Services at SoftTech. In his current role, Chris helps organizations to uncover issues in clinical charging and revenue integrity. He brings forward unique solutions to address clients' challenges with Cerner Millennium, resulting in improved efficiency and stronger performance of their systems. Chris is a problem solver at heart and is highly proficient in healthcare workflow processes within Cerner Millennium EMR systems. Prior to SoftTech, Chris spent 6 years as a solution delivery consultant and senior analyst at Cerner and 2 years as a departmental team lead at Ascension Health Information Services. Welcome, Chris, and the floor is yours. Thank you.
Thank you, Mark, and thank you, everyone, for joining us today. I'll give you a little bit of a background on who SoftTech is, and then we'll talk about the pandemic and how it's caused financial impacts to healthcare organizations. And lastly, we'll talk through how those changes have impacted our Cerner billing processes. So, who is SoftTech? Well, SoftTech's actually been in existence for over 25 years. We have been renowned as being known as the experts of monitoring and auditing Cerner Millennium systems for the past 25 years, which I've been a proud member of for the last 10. We do have partnerships with over 200 different Millennium hospitals, and our primary mission is to make sure that each one of the Millennium hospitals are getting the most from their Cerner investment. COVID-19, this pandemic, and how it's impacted the healthcare organizations. Well, as you can see, there are many healthcare organizations out there that have had to change their behaviors on how they practice health. When this pandemic hit, one of the greatest things about a Cerner EMR system is it has such great ability to be flexible. So in this situation, when the pandemic hit, the hospitals had to realign how they were practicing health to their patients. And as you can see, some of the things in the slide indicate some of the impacts that the organizations had to endure. As more COVID-19 patients presented to the hospital, those resources that were usually used for elective procedures and or other preventative health activities within the healthcare organizations had to shift to help with the load from the pandemic coming in. From that financial side, that causes a rift or a problem in how you were maintaining your financial viability as you were moving forward with that. So with the Cerner system, clinically, they were able to quickly adapt to the clinical need. Again, that's one of the benefits of having the Cerner system. It does allow you to practice as it needs, as your needs arise. And then from the billing side, it also has that flexibility to be able to change your forecast or your direction that you're heading. Now, as this change that the pandemic caused, it did cause the clinicians to become more stressed or worried about, at least from the financial business office side, of how are we going to maintain our viability, our financial viability, if our revenue stream is changed based upon the acuity of our patients that present in the hospital. When this occurred earlier in the year, and this was real early in the pandemic, there was a call out to us from our clients to say, hey, we need that extra set of eyes and expertise that you bring to us today to help us follow through on what we need to do with this new change that's occurring. Now, one of the things that we know about the Cerner system is it has a tendency to accommodate many different ways of handling charges that are happening based upon activities that the clinicians are doing with the patients. And having the visibility to all of those charges and the changes that occur in that Cerner system is vital. Because if you just play like the Ron Paul and wind it up or build it up and forget it, it doesn't really help you when this dynamic shift occurred, like with this pandemic. So SoftTech, with its expertise, had the ability to be able to very quickly and clearly show them, here is where you're standing, here is what is happening, here are the different mix of how your revenue or charges for your clinical activity is occurring in your system today. And then as the pandemic started to impact the system, we were able to start guiding them down that path of, let's take an assessment, right? Let's first look at your integrity of your charges. Are your charges, every time that their orders are being completed, are they actually dropping the charges as anticipated, including the new charges or the new orderables for the COVID-19 tests and or procedures that you've created? The next thing that we did is we were able to identify all of the different orderables that had slipped through the cracks. Because with the new pandemic, there were new workflows that the clinicians were being subjected to, or you had members who didn't normally process those workflows, and especially with the new restrictions around isolation and whatnot on these individuals, you wanted to make sure that you had a consistent workflow as well as a consistent system that adapted to these individuals having these different workflows and the outcome being still dropping the charges needed. So when we actually logged into their systems, and we worked with quite a few clients individually, with our tool set, we were able to very quickly identify which actual orders that got completed were inconsistently dropping charges, specifically around the COVID pandemic pieces. And within seconds, we were able to quickly identify not only the volume of the number of completed orders that produced charges, but we also were able to show within seconds all of the cases where the charges were not dropped when they should have for that process. And then while working with them and helping them identify what were the missing pieces, was it a workflow issue, or was there actually a build process needed to compensate for the new dynamic shift? And this all happens when, if you normally have, let's say, an emergency room that has a 15-bed capacity, and now you've got new patients that are coming into the emergency room, and you had to switch or accommodate other departments of the hospital to be your your auxiliary emergency room beds or ICU units. And in doing that, that would cause, when you assign patients to those locations, the old location rules, if you will, no longer apply to these new COVID procedures that are happening. So there has to be a quick accommodation or a shift change like the Cerner system does, the ability to say that these patients in these new units or these units that have been reassigned have the same cost charge capability as through the emergency room departments. So from that, we were able to quickly isolate, like I said, that the specific patients that fell into these situations. And from that, with able to utilize their Cerner tools as well as their Cerner build capability, they were able to go back and actually recover those charges. Now, at the same time, these organizations were being pressed, right, from a government, state, and local level to produce metrics or matrices of what was happening around the number of cases that they were seeing, how many tests were they doing, how many were positive, how many of those cases that were positive actually had a negative outcome or an outcome that was caused because of that COVID-19 diagnosis. And so this was a little bit difficult early on because there was no standard out of the box, hey, we just need to pull up these reports and we have all the information there. And if you can remember back at the beginning of the pandemic, there were a lot of things that were unknown. So as these requests came from the entities, they changed. It started out with how many cases, and then it was how many cases ended up being more severe with these different DRGs, and then down to, how many deaths from it and how many comorbidities. So all of this is in the Cerner system, but we had to work with each and every client to help them go get the information within their system. One of the things, because we've been in existence for over 25 years and truly are an auditor to the Cerner Millennium system, we have mapped the entire data table base. We know where the data's at. So all we had to do is work with them to help identify what pieces of data are you asking for, and we will real time be able to go get that information for you and allow you to be able to start reporting on it, because as you remember, they were doing this reporting on a daily basis, and they can get that information out to the authorities who needed that information right away. This is a kind of an example of how we very quickly were able to generate a report by day to give them the totals of each one of the pieces they were looking for. We also gave them the ability to be able to drill back down into these reports so they could, on a case-by-case basis, be able to see if there was multiple testing going on the same patient, or were all of these actual individual cases, and therefore the head count would be accurate from that perspective. After working with these folks, like I said, and having the ability to be able to quickly identify those pieces, and this is an example of the more detailed level, we'd be able to see the orders that were done, the individuals that this was done to, and what the results were. So was it detected, was it not detected, was it a bad sample, does it need to be retested? All of those were found in the details, and they had that ability to not be lost during this pandemic. And in finding this information and helping them regroup and help them with their build, they were able to then go back and recover every single one of the charges that they were missing before. And what that really solidified from the business office perspective is, although the dynamics of how the money was earned by what medical service they were providing had shifted, at least with the new way that you were practicing healthcare, all of it was being recovered or was being counted on and counted for. So that was just the first part of being able to quickly help them adapt as the healthcare world changed when the COVID-19 hit. And then with additional tool sets, we were able to allow the business office to start looking at, okay, the healthcare, your healthcare world has changed, and this is your new reality. So based upon the new reality and knowing that your revenue, based upon the work that your clinicians are doing, is fully recognized in your Cerner system, what are your next strategies on how you move these forward? So getting reimbursed for COVID cases, right? Who's going to reimburse it? How fast do you have to get those claims in before they get being reimbursed? So again, the Cerner billing system, the patient accounting system, is a great system that allows you to look at these pieces. And with our SoftTech tooling as well, we have the visibility into that world to show them, here are all your COVID case accounts. Here's what's holding them. And as we know, we fixed the charge side of it. That's usually never the problem. It usually kind of goes back to that where the patient was registered piece. But again, working through those pieces, it allowed those accounts to be readily able to be billed in the shortest amount of time. And that is how we were able to walk our clients through that journey around when the pandemic hit. There was a shift clinically and financially, but with our help and assistance and visibility, they were able to very easily, one, capture everything that they were doing, and two, use the new playbook on where we go and how we can adjust moving forward with the new way that we practice healthcare. Now, there are some true questions that we have here. I'm going to go through a litany of these questions. This will be your opportunity to be able to ask questions. The first question I have here is, does our software work with third-party billing systems as long as you have a Cerner EMR? The answer is yes, because the charging side of a Cerner Millennium system is what we're looking at. Now, the only difference between a Cerner billing system and a third-party billing system is when you have a third-party billing system, after the charge gets evaluated in the Cerner system, it is then interfaced out to that third-party billing system. So although I don't get to see costs or prices associated to those charges, I still have that functionality of recognizing that this is a chargeable activity that the clinician performed. The next question I have here is, where can I get these reports and are they available in Millennium? Cerner Corporation did actually come out with a standardized module around COVID-19 somewhere in the area of late March, early April. The only and so with that, that intent was to be able to provide that level of reporting for all Cerner clients. Each and every Cerner Millennium system is uniquely different. And so if I actually created an orderable in my Millennium system, it gets a different nomenclature or a different code value when I created it versus another hospital who did the same thing. So when this reporting module came out, it did help try to gather those things, but there's still a crosswalk that has to be done to determine, based upon what was already built around COVID-19, to be able to assimilate into that reporting factor. So you can get COVID-19 reports in the Millennium system. They've done a really good job of trying to standardize that with their model approach around how they did that. The next question is what if there use batch charge entry and there are no orders? So you can definitely use batch charge entry, which is a feature within the Cerner Millennium system. It's designed to be able to put in charges, for an example, when there isn't an order associated with that. However, that's probably not the best practices around charges, especially like for COVID-19, because you're going to want clinical recognition, and that is only done through the ordering process within the Cerner system. So Cerner is very keen about the clinically driven revenue, and in order for that to happen, the order has to be placed by the clinician. So although batch charge entry is something you can do from a post side of it, or the business side of the house, if you will, you do have to keep in mind that the clinical world needs to have record of why that charge existed. And without having that order in place, you miss that element. The next question I have here is, can you see what the reimbursement amount is? Well, yes, the Cerner tool, especially around the SoftTech tool, especially around patient accounting, does give you a real time of any reimbursements that have been done on any of your accounts. As a matter of fact, it'll even show you like a report card based upon who your payers are, how much or what percentage of reimbursement are you getting from each one of those, which is something uniquely important, because when you go into your contractual conversations with each one of these payers, oftentimes it's very difficult to determine if whether or not they're holding up to the contractual agreement they have with you. So this, again, is another level of visibility that our tool set is providing for clients that allow them to conduct their business office revenue perspective more efficiently. Next question, how does Cerner billing and charging process support telemedicine services, especially during this pandemic? Great question. Now, ironically, this pandemic wasn't the first representation of telemedicine services. However, this pandemic truly brought it to light that this is a highly effective way of conducting healthcare. The good news is being able to create the bill items or the orders for telemedicine, or even if you were going to fill out a power form, which is a document that a clinician fills out in the Cerner system. And in filling out that document, especially let's say the time spent on a telemedicine call, those items that are filled out in that document will drop charges, they're called alpha charges, that would precipitate the correct dollar amount for the use of that telemedicine. So we have a clinical track and a note showing that there was a telemedicine visit done and these were the things that were discussed. And then because they did their clinical act, when they signed it, the system automatically dropped associated charges to that, and then that gets passed on to the billing system with the correct bill codes and the correct CPT codes assigned to that. So it has truly become a much more recognized way of practicing healthcare, and I do see that that will become a stronger way that things will get done in the healthcare world. The next question I have is, how does the physician use different EMR systems, manage billing and charging processes? So this is often pretty difficult. If your Cerner is your primary EMR system, that's great, but and that makes it kind of easy when you do look at how the work is done in the Cerner clinical world. It automatically will follow over into the Cerner billing world. But you do have other departments, like I'll use cath lab for an example. So you might use a third-party cath lab to do your entire procedure for that. And in doing your documentation, the supplies, the anesthesia, and the time, and all that in that third-party cath lab system, as long as those charges are interfaced to come directly into the Cerner system will pick those up as though Cerner was the one that did them, and it will report the clinical part of it, the notation that was done during that cath procedure, into the patient's record, and then all of those charges will automatically flow back over to the Cerner billing system. Now, I do have clients that do have disparate other billing systems, like in an ambulatory setting, where they might use the clinicals within the Cerner system. However, any of the professional charges that they utilize is done through another billing system, and therefore those charges then would be interfaced out into that third-party system for that billing. But the clinicals would still be into the Cerner system. And we have full visibility to all of the Cerner stuff. We will not be able to see that third-party billing stuff because it's not a Cerner billing system. The next question I have here is, how can we further automate charge validation processes? Well, that's a great question. That's how our tools have come about. One of the things that we truly like to do is help eliminate the constant run this report, let's bring them into Excel, let's cross them over, let's put the data together, let's analyze it, and let's find out what's actionable. There's really two things that I always say to every client that comes to us with a request of how can I make this process automated. And the two things that I have to say is, one, is the data that you're wanting actionable? So in other words, me providing you with just data is not good enough. I need to be able to show you where are the things that you need to take action on. If there's nothing to take action on, great, then make a statement to say, hey, everything looks good. So it is a true ability to look at that. And then the next thing I always ask them is, do you understand what taking action on this information that you're getting, what is the downstream effect? So oftentimes, especially in the clinical world, you'll have someone say, hey, we want to follow this workflow in order to produce this outcome. Well, that's fine, but we need to understand what are the downstream effects for if you build the workflow this way. What are the other pieces? Are there other departments? And or is the billing office, how will they assess things, and can it automate to automatically take into the new parameters that you're doing? Prime example would be, can you create an orderable that automatically adds a modifier onto it based upon no criteria? That again goes back to the coolness of the Cerner system, is it has ways to create rules that will automatically do these things. And charge rules were designed around charge transformation rules. Were designed to do things like that, as well as the billing side. There's billing rules as well. Great questions, guys. My next question, could we perform analytics to analyze trends or generate metrics in order to generate provider score against their goals while managing Cerner billing processes? Yes. Emphatically 100% yes. We actually have a feature in our tool set that is called physician documentation. And in doing this, it literally lists by physician the number of notes that they have done and the number of professional charges against those notes that have been done. So it's automatically starting to show the gaps in, here are the notes that they created, but there were no professional charges put into the system. That's a loss of revenue, and that's a failure of workflow process. But then it's also showing, here are charges, professional charges on the patient's record, but there are no notes by the clinician. Again, that's a failure of the workflow process. It is one of the first steps, and there are other tools and capabilities like RVU report. We do have RVU report, which actually several of our clients utilize to incentivize the clinicians to determine what is the volume of the care that they're doing with the patients. So yes, these are some of those factors that allow us to very quickly see not only based upon the volume of what the clinicians are doing, but are they meeting standards that the organizations have set up? Another great question. The next question is, how can we triage patients based on the actual level to accurate billing processes at the time of the patient load or the emergency situation? That is actually a very great question, and it does actually take us to the next level of, based upon the load, what is our strategic outcome? I think that there's definitely some need for some growth in that world, and I think Cerner's kind of playing in that right now with a little bit of their artificial intelligence that they're trying to do, and their community works perspective around the trying to find out the level of comorbidities and whatnot across the population. So there is still definitely growth, I think, that could be made there around automated processes to start setting thresholds to let organizations know, hey, based upon your intake and the acuity of what's coming in, you're going to want to make adjustments or realignments of other parts of the hospital, as well as changing forecasts based upon that. There definitely is some new pioneering growth that needs to happen in that part of the space. And because we have full access to all of the visibility, all 15,000 tables in the Cerner monitoring system, yeah, that is something that we can definitely help work with. The next one is, what are some of the future strategies to further improve ROI using Cerner billing and charge processing? This is something that I help every single client that I deal with, and I always go back to the basics. The first is, let's make sure the things that we have built to drop charges are dropping charges 100% of the time. So let's go pick up the stragglers, right? Let's go find the charges that are suspended or on hold or are pending or in a manual status. All of these different statuses do not turn into real money until they've manually been intervened to become posted. So that's step number one. Step number two is using that charge integrity tool that I talked about to go verify that every time the order was placed, it did drop a charge like it was supposed to, not happening inconsistently. And so for the ones where it did not drop, we go back and get those. It could be a registration modification. It could be a reteaching of a workflow process to an individual, like a respiratory therapist who filled out a wrong form. Those would be step number two. Step number three would be go look at the things that are being ordered, but every time the order is being placed, it's never dropping a charge because no one told anyone that that is a chargeable event. So that will be the third level of being able to go clean that stuff up. And then the fourth step, I kind of move, well, there is actually a fourth step of having conversations with each clinical department to discuss other opportunities of services they could provide directly to the patient. However, my next layer that I go work with on clients is, let's go clean the books up. Let's go clean up the discharge not final billed stuff that's been sitting out there for over a year. So if you're not ever going to recover that, the likelihood that you ever are is slim to none. Let's go clean the books. Let's go write that off. Let's clean it up. Let's go find the mistakes where we credited back more than what the actual balance was on the account. That shows a negative impact, right, to your liabilities. So let's go clean those books. Cleaning those books up. Also looking at what's currently in play in your encounter holds, being able to address the high dollar that have been sitting out there for more than 15 days or greater let's go get those moved. Because the sooner we can get that to the payer so we get paid, the better the ROI becomes on our system. And that's really a process of how you can go about increasing the ROI on using the Cerner billing system. Guys, I have to tell you, the Cerner billing system is a very good system, but it is very, you have to have your eyes on everything it's doing in order for it to produce for you. It's not as simple like McDonald's, you just order a number one and you automatically get it. The next question is does Cerner support processing claims for the clients? So if you're talking about a client encounter or ambulatory doctor's offices, yes, the Cerner Millennium system does a great job of whether you're acute or ambulatory. As long as all of that data is in the Cerner Millennium system, you can truly do all of the processing of those claims. So I just got done working with a client who shares their environment with several other hospitals and multiple different ambulatory systems, offices and centers. And yeah, they do all the billing for all of them. So you can do that. The Cerner system would allow you to very easily accommodate that processing. The next question I have is there a clinical decision support system embedded within Cerner to generate alerts for missing charges and events to manage the billing processes? In my 20 years of experience with Cerner, and building rules is one of those, there is no easy way to determine that a charge did not drop, or an alert system that let me know that a charge didn't drop on something that we thought should have. I can generate reports. I can go look at data that's in the system and try to do a cross map based upon here are the orders that got completed, and then I can go over to the charge table and see, do I see any charges that are affiliated with this order? Again, that is a more manual way of doing it. That's kind of why the solution that we have on the charge integrity, which is strictly around orders, came about, because clients asked that very question. And then with a single click, they could see and allowed you to make those adjustments to those accounts right away, so they don't end up being late charges. Which, by the way, late charges in the patient accounting world, I'm sure it's more than just Cerner, is an absolute nightmare, because it's another opportunity for a payer to deny the recovery of that late charge, plus the additional work that it causes. So great questions, guys. I have gone through the list that I have. At this time, if there are any other questions that you might have, feel free to ask. I know you'll have access to the slides and this entire presentation after this. If you have additional questions, I know the people that I work with at SoftTech are more than welcome to field those questions for you. If you need help in giving better understanding of what we do and how we do it with Cerner, they can definitely help you with that. Well, it's been a pleasure. Again, I enjoy and welcome any type of comments that you might have, and I hope it's been important information that you found useful, and all I have. Thank you.